and welcome to the Cigna Check-In, a series based on the findings of our ongoing Cigna COVID-19 Impact Study, an extension of Cigna's annual 360 Wellbeing Survey, launched at the start of the pandemic to research the impact of COVID-19 on people's well-being around the world. Here, we'll look at the insights to deep dive into the triggers of stress, where they may come from, why stress may be heightened in these difficult times, and most importantly, to provide you the tools and information you need to perform successful stress care check-ins on yourself and those you care for. I'm Patrick Rona, Head of Brand and Thought Leadership for Cigna International Markets, and today I'm joined by Dr. Joyce Chao, Clinical Psychologist from the Dementia Center in Hong Kong, and Dr. Ethan Lim, Medical Director at Cigna Singapore. Thank you both for joining me.
Thank you for having us.
So, by way of introducing this topic, we live in an age where we have more access to media than ever before, and sometimes that includes misinformation or different theories about what the causes of what's going on might be. What does this do to people in a global situation like this? Dr. Joyce, how does the sheer volume of information consumed in today's world have a heightened psychological impact on stress?
Today, when we have to deal with this global and situation that is so new to us, so our natural response is to go and seek information. And of course, today's world also have the reverse as well. It's kind of engineered in a way that we are kind of pushed to stay on. And we want to be informed, of course, and to prepare ourselves. And then we have also the technology to actually kind of hook us into being stay on all the time. So indeed, it's very important that we kind of monitor the information that comes to us, and also we need to kind of learn how to process and filter the information that we actually consume. And because the information that we consume might affect how we think about certain ideas about ourselves and others. So in some ways, it's almost like, we have to do some kind of cleaning once in a while and make sure the things that we get in, it's going to be helpful and useful and good for our mental health and well-being.
Dr. Ethan, beyond the world of media and digital, how do the many spinning plates of childcare, job uncertainty, vulnerable family members, et cetera, add up to affect and potentially overwhelm people?
So if you are constantly bombarded with information, all different inputs from the other aspects of your life, let's say family or work or things that's happening around you, you do become more distracted. You are actually more stressed, mentally taxed. And that's when you run into the danger of having this overwhelmed situation where you feel like you cannot cope anymore because this is not something within your current experience that you are able to manage. So that can really push people to the limit.
Dr. Joyce, in the current climate, who could potentially be someone in the community most at risk of feeling overwhelmed?
Okay, so there are a few groups of individuals might be more vulnerable. So people who are living alone, and young people, and people already have very high stressed and high pressure kind of jobs. And also another population would be the elderly. So because of the isolation problem, then they may not be, very efficient in using technology. The other group would be young families, and they have to be stuck in a small quarters. And then in that sense, it can be very, very challenging as well. So these are the typical, I would say, groups that we have to watch out and pay particular attention to in terms of giving care and support.
Dr. Ethan, what are the signs that one can look for in a loved one who may be feeling overwhelmed?
I think very commonly we think about people unable to sleep, unable to eat well, being moody as even earlier signs of things that you can pick up. So I think when you do see that eating patterns have changed, that is always very good sign. Some people have stress eating habits. So when they're stressed, they tend to eat more certain foods, or they just eat more in general. Problems with digestion, stomach problems are very common. Skin problems are very common. So people with starting to have more acne, or they start to have rash all over, that sometimes it's a fact that the immune system and the body is not coping well as well. Because mental stress does place a huge burden on the physical body as well. And so a lot of the manifestations do appear in these things. But if you start to think that, hey, somebody is not really himself or herself for a couple, 2-3 days in a row, I think that's something that you would want to look into and check in on them.
Dr. Joyce, what positive impact can a stress care check-in have when done regularly with members of your family or your community?
It's very important that we do the self-check ourselves first. What is our level of stress, so that we are better prepared to help the people around us. And then we check on others. And when we do check on others, what happens is that we build this connection, and this connection that is open, and this connection that is a mutual support, and may not be like for, like check on for a day, but probably just half an hour sometimes. But it's good to know that we can communicate, and we can talk about sometimes that the very basic need that we need support from the people around us. So the open dialogue and open discussion would be a very helpful way to start the whole support system. So this check-in would be very important indeed for individual, for company, and for organizations, and for the society.
Great, thank you very much. Dr. Ethan, can you expand a little bit on some of the techniques and tools that someone might be able to use when you want to check in on somebody you suspect is feeling overwhelmed?
There are many things that you can do when you want to check in on someone. There are obviously, just if they are around you or in the household, it's just a simple thing of saying hi, hello, how are you, or just is there anything bothering you, or is there something that you want to talk about? I think that it's, of course, assuming that it's a good relationship to start off with. And I think within the family, that's usually not a problem. But you can also start off with something that is about work, about school, or about friends and relationships, to lead into more specific things that you want to check in and make sure that they're doing okay. There are all the digital tools, or even just pick up the phone and do the same things as well.
Thank you very much. And I know that there are a lot of companies that are developing new tools and services to help people identify and manage stress, and hopefully will make stress management even easier and more accessible. Certainly within Cigna, it's one area of focus of our innovation efforts, and I know you and I have worked together on that in the past, Dr. Ethan, so thank you.
And there are many tools out there that we can all use, digital tools, digital health solutions, apps that tell you what you are doing, wellness apps. Cigna has a wellness app as well. And so all these things can be at your disposal. And I think we just need to explore a little bit and help ourselves more.
Brilliant. Thank you both so much. That's all we have time for today. As we've learned, the feeling of being overwhelmed is certainly heightened during this time, and making sure that you perform regular stress care check-ins on yourself and those you care for is vitally important. For more information on how to perform impactful stress care check-ins, find free advice around stress, and see the most up-to-date Cigna information and insights, please visit our dedicated hub. I look forward to welcoming you back soon to our next episode. Thanks again.